footage. Okay, hello friends, hi. My name is Doc Mo and welcome back to the Crush Course AFP. So our video today is going to be on the research interview and how to excel in that. So the research interview can come in a number of different shapes and sizes, and we'll be touching on that later on in the video. Okay, let's get cracking. So first thing that we're going to talk about is what they're looking for in candidates at this stage of the interview process and what they're looking for you to be able to demonstrate when you're talking to them in the interview. The next thing is we're going to talk about the structure of the interview, which obviously can vary from deanery to deanery, but we'll just talk a little bit about that as well. The next section will go through how to actually pull apart a paper. And the way that we'll do this is we'll go through the method that I use for every single abstract and every single paper that I did in preparation for this interview. Then we'll talk about how to present this now that you've deconstructed the paper, and how to actually convey your criticism to the interviewers who are opposite you in a confident way and in a systematic way. And then what we'll do is I'll just go through some tips and tricks. So that's what we're going to be doing. Okay, so what are they looking for in a successful candidate? Okay, so they're looking for someone who's got a broad, and I emphasize on the broad, a broad awareness of the research process as a whole. And what I mean by this is you've got to be aware of the fact that you've got to collect preliminary data, gain ethical approval, getting grants, and you don't need to know the specifics of how to do all of that, but you need to have broad awareness of all of it. The next thing you've got to be able to do is you've got to be able to critique other people's work as well as your own. And in order to critique work, you need to be able to pull apart a paper, which is what we'll be doing later on in the video. You've also got to be able to do some data interpretation, okay? So you're not going to be expected to do advanced statistics, but you do need to be able to interpret data. Now there's going to be a separate video for this because I didn't think it would be appropriate to put it all in one video, it would be too much. But you do need to be able to feel comfortable working with some basic medical data. Okay, so what will you be expected to do as part of the research interview? Well, it's actually very varied, and in my opinion, it's more varied than even the clinical interviews that you do. Some places, such as London, quite clearly signpost the fact that they'll give you an abstract and you have a set period of time to look over it, about 25 minutes, and then you have to critique the paper in that time period, and then you present that paper or that abstract to a panel, and then they will ask you specific questions regarding it. That's one kind of way that they can do it. Another way that they could do it is that they could give you some data which they then ask you to interpret. So some places will give you a table and then ask you to calculate a relative risk from it, or an odds ratio from another bit of data. Other places have got some really strange requests, so they will give you a graph which is not labelled and then ask you to interpret that graph, what it could mean, and then from there they start to ask you about research questions. The key thing is just don't be thrown off by this. Okay, the principles for all of these different interviews are the same. You just need to have a basic bit of knowledge about how research works, a bit about data interpretation, and then you'll be fine. Some places might also ask you about a paper that you've recently read, or some papers that you've recently read if they're really challenging you, and some of the deaneries will ask you to bring in some examples of research that you've been interested in and then critique that paper off the top of your head in the interview. Those can be a little bit tricky to prepare for, but as long as you know that that can come up, there shouldn't be any problems. And then finally, they might ask you a little bit about your own research inside the interview. For the London AFP, they don't actually spend a lot of time talking about your own research, but for some of the other ones, there are dedicated stations where you talk about your own research. You should be able to critique your own research and be aware of the strengths and weaknesses of what you've done. Don't just tell them what you've done, tell them why it was good, why it was bad, and what the limitations were, and how you would be able to improve it moving forward. Okay, so now we're going to move on to the main chunk of this video, which is how to actually pull apart an abstract or even a paper for that matter. I think it's really important, just like you've got an A to B approach for assessing clinical patients, that you have a robust approach to assessing an abstract. And the method that I'm going to present to you here is the one that I use, and I use it for every abstract like I mentioned earlier, but there are 1,000 different ways of doing this. There's none that's the best. They've all got their strengths and weaknesses. The important thing is that you just pick one that works for you, and I'm going to present one of these ways, the one that worked for me, and probably the simplest way in this video. I also want to say that the single most important resource that I used in preparing for this, other than by going through a number of papers, was Trisha Greenhouse's book, How to Read a Paper. This is an excellent book, and I would 100% recommend that you read through at least the first half of this book when you're preparing for this interview. It covers everything in great detail, but also with great clarity, and I would highly recommend that you read this book in your preparation. So we're really standing on the shoulders of giants with this video, and I'd recommend giving that book a quick read. The final thing is that if you're a researcher and you've already published 1,000 things in Nature, this is not going to be a video for you. It's going to be really simply how you can pull apart a paper when you don't have any experience, and that's the assumption that I'm going to work with at this period of time. Okay, so go and get a piece of paper, literally go and get a piece of paper right now, and then at the top left, write PICO, P-I-C-O, and I'll explain this in a second. Now at the bottom left of this piece of paper, I'd like you to write inclusion criteria, exclusion criteria, study design, and methods. Then on the right hand side of that piece of paper, towards the bottom but not quite there, write results, conclusions, and stats. Okay, just write those three things. And then finally, right at the bottom, write in brackets, and you'll see what I mean in a second, but write in brackets internal validity, external validity, and then finally going forward. Okay, now in order to do all of that, it will take you about 21 seconds, but I would highly recommend that you do this for every abstract, because now what we're going to do over the course of this video, and when you're preparing for abstracts, is fill in this template, and by the end of it you'll have something to say that's quite meaningful about the paper, and you will have identified the key strengths and the key weaknesses of the paper. Okay, so let's start off with PICO. Now PICO is not something that I've come up with, it's something that floats around quite regularly and is used by a lot of people, and it stands for population, I is for intervention, C is for control, and O is for outcomes. And what this is it gives us an overview of what the paper is all about. So if you can talk about those four things, then you can basically summarize in one sentence what that study did and how it did it. So that's what we use PICO for, to get an understanding of the paper. Okay, so P, population. Who was included in this study? Who were the subjects that were included as part of this study? It could be quite broad, like anyone with type 2 diabetes, or it could be quite specific, like individuals with varicose veins who also have bleeding and symptoms of the varicose veins. So it could be quite specific. The intervention is the thing that you're trying to look at. Now, it doesn't have to be a medication. It could be a surgical procedure, a new therapy. It could be anything, okay? So the intervention is the thing that you're looking at. C stands for control, and you need to be using the current best gold standard treatment, okay? So you can't, if you are doing a study into statins, do a new statin versus placebo, because we already have loads of statin. You need to do the new statin versus the current best. So that's really important, and a lot of studies try to cheat. They try to decrease the dose of the control, so you've got a bigger effect size, or they try to have placebo as a control, and that's not the best way of doing research, and it's exaggerating the effect of your new intervention. Okay, so O stands for outcome, and this could either be an intermediate outcome or it could be a definite endpoint. What's the difference between these? So let's go back to that statin example. Let's say that I wanted to see whether the statin decreased the risk of stroke. So we could either look at the number of strokes that occur, but that could take a long time for us to see an effect, or I could look at an intermediate endpoint, such as the size of an atheroma in the carotid artery. That would become an intermediate endpoint. The issue with these is that they're often easy to measure but not super clinically relevant, okay? So if we were just checking out the size of the atheroma, it doesn't take into account the stability of the plaque, the composition, and other factors which might then result in a stroke being more likely. So just bear in mind, is this an intermediate outcome that we're talking about, or is this a definite endpoint, such as the occurrence of a disease or death? Okay, so we've dealt with PICO. Now let's go down to that bottom left side of your piece of paper, okay, where we're going to talk about study design. Now, everyone knows that randomized controlled trials are quite high on the hierarchy of evidence, okay? However, these studies are often very expensive, require huge amounts of resources, and can also take a long time to do. So there's a number of other kind of studies that we do. In the AFP interview, generally speaking, you will be getting RCTs because they're quite easy to critique and pull apart. However, I'm going to briefly talk about the other kinds of studies just so that you're broadly speaking quite aware of them. Okay, so one that's quite low down in the hierarchy is a cross-sectional survey. And this is a static cross-sectional analysis of what's going on in a population. So for example, it could be a simple question like, how many people have gastric cancer at a given time? Now that might seem quite straightforward, but actually it can be quite useful. The pros of this kind of research is that it's quite cheap, it's quite quick to do, and you can use it almost to keep your finger on the pulse of disease trends, okay? So if you can repeat these studies every couple of years and see, is the number of cancer diagnoses going down? However, they don't give us a tremendous amount of data about causality or the effect of different interventions. Okay, so the next kind of study that we're going to talk about are case control studies. Now, what's a one-line summary of a case control study? Essentially, you take people who already got the disease and then you find controls to match against these cases, okay? And then you look backwards in time and you have a look at the exposure of both groups to various risk factors. So we're looking backwards, and we started with people that have already got the disease. That's where we started off with. Now, it's important to note that these studies are retrospective, okay? They are looking back, and you'll see why this is important in just a short while. The other thing is that the risk factors that we're talking about could be anything, okay? Could be smoking, the number of calories that you consume in a day. It could even be just, do you consume bubble tea? It really doesn't matter. The point is that these are all risk factors, and you can analyze a number of risk factors in a single case control study. So what do we use case control studies for? Well, we use them to identify risk factors which may contribute to the development of a disease. And we use case control studies to calculate a statistic known as a odds ratio. Okay, an odds ratio. So just bear that in mind. Case control studies are associated with an odds ratio. That's the statistic that we use. What are the advantages of a case control study? Well, because you start off with the people who have the disease, it's really useful for rare diseases, okay? Because you've already started off with those who've got the disease. So when we're looking at rare diseases, think about case control studies. The next thing is, because they're retrospective in nature, generally speaking, as long as you've got the databases already there, or you've got access to health records, they are quicker to perform than studies that go forward, that are prospective in nature, generally speaking. They also tend to be cheaper than prospective studies for much the same reason. And finally, you can use them to analyze multiple exposures, almost look for risk factors which can predispose to disease. So this might seem like you're fishing for an association and for risk factors, but it is something that is a strength of case control studies. Okay, so what are some of the disadvantages of case control studies? Well, first and foremost, they rely heavily on the quality of the records that you're reviewing, okay? Because it's retrospective in nature, you need to have accurate records in order to get accurate results from the study. So that's the first thing. The second thing is that case control studies are also susceptible to a number of different types of bias, such as selection bias. So are you identifying all of the patients who do have the disease, or are there some that we're missing? As well as recall bias, because you're asking patients about exposure to risk factors, there may be a degree of variation in the way that patients who've got the disease recall prior experiences. For example, if we were looking at causes of chronic back pain, for example, that was a disease, as it were, that we were looking at. If you asked people with chronic back pain, did you used to lift heavy weights when you were younger, they might be more inclined to say, actually, yes, I did. Whereas people who don't have back pain may have forgotten that they had been lifting weights when they were younger. It's a bad example, but I hope it highlights the fact that case control studies are susceptible to recall bias. Okay, and the other thing with case control studies is you can't really demonstrate a temporal association, okay? It's a bit like the chicken and egg scenario. So imagine we were looking at a study which is looking into migraines and the causes of migraines. Well, if I were to ask the patients with migraines and the patients who didn't have migraines, do you use paracetamol, okay? It might be that my study turns out to show that the patients in the migraine group used paracetamol more. But is that the trigger that caused the migraines, or is that because they're trying to treat the migraine with the paracetamol? So you can't demonstrate a temporal association with case control studies. Okay, so to summarize case control studies, you started off with the cases, you look backwards, and you use it to calculate an odds ratio. Okay, so the next thing obviously that we need to talk about is a cohort study. So the one-line summary for a cohort study is that you start off with a population of people. You might have people who are exposed to a certain risk factor and people who aren't exposed, and then you go forwards in time, okay? So they are prospective in nature. And then what you do is you try to identify who developed the disease, okay? How many people developed the disease between the two groups, and compare it. That's what you do with the cohort study. These are useful because you can demonstrate causation, and you can also demonstrate temporal association, okay? So that's why we use these studies. We use them to calculate something called relative risk, okay? We will talk about relative risk in my stats talk, which I will record, and here's a link to it over here. We'll discuss that further over there, but the important thing is just that with the prospective cohort studies, you use it to calculate relative risk. Okay, so the advantages of cohort studies. One, you can assess the temporal relationship between exposure to a risk factor and development of a disease, and that's quite important. The second thing is you can assess prognosis, okay? Because you're going forwards in time, you can collect data on how the disease evolves and progresses once an individual develops it. And then the third thing is that you can more accurately and robustly control data collection because you're going forward. It's a prospective study, so you can control that data collection more than if you were doing a retrospective study where you're already relying on data that's been collected, okay, in the past. So the disadvantages are really just the opposite of those for a case control study. So one, they're quite expensive. Two, they require more time and more resources because you're going forwards in time. And the third thing, which is kind of a more subtle thing, is that they're not as good for studying rare diseases. And the reason why is because you are hoping that within your initial cohort, you're hoping that there will be people who develop the disease and that there's a difference between the two groups. But if it's a rare disease, you know, in a massive study, you might still only have a handful of people who develop the disease. And that's why case control studies can sometimes be better in those circumstances where the disease itself is quite rare. Okay, just a really quick note on retrospective cohort studies. These are slightly different. So these are looking backwards, okay? You use them to compare two groups who've been exposed to different risk factors, and then you look at data that's already been collected to identify which patients develop the outcome, which would be the disease, okay? So they're slightly different. They don't have all of the advantages of prospective cohort study, and actually they've got some of the disadvantages, such as the reliance on accurate data records and so on of the case control study. Okay, so we've spoken about the study design, so you can almost certainly have something to talk about when it comes to study design. Okay, so now let's deal with the inclusion and exclusion criteria that we've written down on that bottom left side of the piece of paper as well. So what this is, it's quite self-explanatory, but it's who did we select for inclusion in this study? Were we being too strict with our inclusion, and were we being too strict with our exclusion? So sometimes in, for example, diabetes studies, we might exclude all the patients who are above 65 because they've got lots of comorbidities. The thing is, that means that you're missing out on a huge number of people who are diabetic and over 65. And so you're therefore missing a huge chunk of the population who you should be studying. The other thing to think about is often in surgical studies, you only include patients who are quite healthy. So when you go on to decide whether the results of the study can be applied to the more general population, you need to bear in mind that often these studies are done in healthier cohorts. And then finally, just bear in mind that with cancer studies, for example, they often only include patients who are at a certain stage or grade of cancer, and they will exclude everyone else. So that means that you can only make very limited conclusions based on these studies. Okay, so I'm going to include some links to the next bit, which is about bias and confounding, in the description below, because there are some excellent references out there. I'm going to cover the key things here, so not everything, and this list is by no means exhaustive. So what is bias? So bias is a particular factor which causes a systematic under or over-representation of a particular result. That's what bias is. And generally speaking, we can separate the stages of research in which bias occurs into the designing stage of research, the actual conduction of the research itself, and then afterwards when we write up, analyze, and disseminate the research findings. So let's talk about the first bit, so the actual planning of the research and selecting participants. So selection bias can occur when the patients that I select for my study do not represent the entire population of patients as a whole. Volunteer bias is where the people who tend to volunteer in studies have certain factors which make them different from the population as a whole. So they tend to be more sociable, they tend to be more communicative, they might even have more free time on their hands, and all of these are things to consider when you're recruiting patients for studies. And then finally, let's just talk about channeling bias. So channeling bias is where, say for example, we have healthcare professionals who are selecting patients for inclusion in a surgical study. They might subconsciously be selecting patients who they think will be appropriate for the investigation, and that in itself is a kind of bias. And basically it's where people tend to recruit patients who are going to make good candidates for the study. Okay, and then when conducting the research, there are a couple of different types of bias that can pop up here as well. So the first one could be interview bias. So this is where the interviewer might already know the disease status of the person who they're interviewing, and this can alter the way in which they conduct the interview. So for example, if a researcher was conducting an interview with someone who's got hepatic cancer, they might ask more specific questions about alcohol and previous exposure to viral illnesses, which might predispose them to hepatic cancer. And they might ask it with more detail and in a different way than if they didn't know that the patient in front of them had hepatic cancer. Recall bias is something that we touched on earlier and when we were talking about case control studies, and this can come into play when we're asking patients to think back about their past and their exposure to previous risk factors, for example. And then finally, Hawthorne bias is where subjects change the way that they do things as a result of knowing that they're being watched. So for example, if we're doing a study into hand washing techniques on a ward and people know that this study is going on, they might adhere to the principles of hand washing more strictly than if they didn't know that there was a study going on there. And then finally, for the analysis stage and the dissemination stage, everyone's quite aware of publication bias, which is where we have a tendency to publish results that demonstrate positive findings, okay? And that's because studies that don't demonstrate positive findings are deemed not interesting enough. And then finally, confounding can play a part here as well. So what is confounding? Okay, so confounding, just bear with me, but confounding is where you have an independent factor which is associated with both the exposure factor and the outcome of interest, which is disease, okay? Let's use an example. Okay, so there's an example which is quite well known, which is about a study which demonstrated an association between eating peanuts and developing gastric cancer. And at first it can be quite scary because peanuts are quite harmless, or you think they are, unless you've got an allergy. But then the study kind of identified the fact that actually people who were saying that they ate more peanuts also tended to drink more alcohol because peanuts are readily available in bars and pubs. And so actually it was a confounding factor, and there was a confounding effect going on there. So you can minimize the effect of these confounding factors by either stratification, okay? And this is where you separate your cohorts into smaller groups. So this is where you separate your cohorts into smaller groups based on the confounding factors, and then you can compare whether or not the confounding factor had an effect. Or if you've got loads of confounders and that becomes physically impossible to have all these tiny groups, you can correct or attempt to correct using regression analysis later on in the analysis part of your study. And finally, obviously, you can reduce the effect of confounding if you've got lots of money and lots of participants through randomization and through matching as well. Okay, phew, so we're getting there. So we've now worked through the top bit of the A4 piece of paper and the bottom left, okay? And now we're going to go into the results and stats section. I'm going to link to another video that I've made for this bit, okay? And you can just view that video and that will help you populate that particular area of our sheet of paper. So we'll move on now to internal and external validity. So these are quite straightforward concepts, and earlier on I told you to put them in brackets. And the reason why is because they depend heavily on all the other stuff that we've written already. So internal validity is how well my study results back up that conclusion that I put right at the bottom of my abstract, okay? So it's how well my study backs up my conclusion. Generally speaking, researchers will make legitimate conclusions, but let's use a exaggerated hypothetical scenario to demonstrate how we can make wrong conclusions from our study. So say, for example, I discovered a new drug which we could use for rheumatoid arthritis. And say, for example, my outcome measure, a really bad, really lazy outcome measure, was the diameter of the knee around the joint line. Let's just use that as an example. And say, for example, I demonstrated that actually the size of the joints decreased as a result of this new rheumatoid arthritis drug. So there was less swelling in the joints. Say I did actually achieve that, and that was statistically significant. I cannot conclude that this has made patients' lives better, because I have not asked the patients if it's made their lives better. I've not presented that data, and I've also not asked about pain or anything like that. I've just measured the size of the knee. But this is quite commonly encountered in research, where researchers will kind of take an additional step forward from their data and make a conclusion. And you need to be able to identify these conclusions where researchers have made an inappropriate jump. That's internal validity. So how well does what I've done in my study back up the conclusions at the bottom? External validity is how well the results of the study can be applied to the wider world, okay? So it's how valid the conclusions of the study are to the wider world. So if I've got population in my study that does not resemble the population of patients outside the study more generally, then my study is not going to be externally valid, really. If I've got inclusion and exclusion criteria that are super strict, it's probably not going to be valid. If my study protocol was unrealistic, if we couldn't achieve this realistically in clinical practice, then it's not going to be valid either. So this is just something to bear in mind as well. Okay, that's internal and external validity. There's not a lot that you need to talk about there, but it's something that it would be nice just to drop. Okay, and then finally, for that little bit at the bottom right of your piece of paper saying going forward, just if you can have 1 or 2 ideas about how you could take this research forward. You don't need to be an expert in the field, just come up with whatever you want. And just as long as you've got something to say that's reasonable, it will at least make you look like you're thinking in an academic mindset. Okay, so that's everything that we're going to cover in terms of how to deconstruct a paper. Like I said, go to the statistics video as well, which will talk about the stats bit, how to interpret the stats, and then you should be ready to then present the paper. So how do we then go on to present the paper? I'd say that the first thing is that I would have a look at the PICO bit at the top and then use that as your opening sentence. So this was an X study comparing something to something else, and it demonstrated that there was a 23% reduction of something. That's how I'd start off with. And then what you need to go on to say is the key strengths of the study were X, Y, and Z, and then the key weaknesses were A, B, and C. The results of the study suggest that we should do something. Okay, so this is the change in clinical practice. There's a lot of somethings in this. And then finally, you can say, going forward, I would like to do this if I had resources. Or going forward, it would be interesting to see if the researchers went on to do this. So just offer up that. And that's really the way that I presented the paper at my interviews. And it meant that therefore, after about 2 or 3 minutes, the examiner would then be able to ask me some specific questions regarding what I'd already said. So for example, they would ask, what did you think of the methods? Or what do you think some of the other weaknesses of the study are? I remember that one of the interviews, they asked me, okay, if you had unlimited resources, how would you improve on the way that the study did their research? So by having that lovely introduction, where you spend about 1 to 2, maybe 3 minutes talking about the research, you've then given the examiners a lot of content upon which they can further ask you questions about. Okay, so in terms of the tips that I'd recommend in order to succeed at this academic interview, the first thing is I'd recommend write on the piece of paper, okay? Write on the abstract that they give you. I prefer this than writing on a separate piece of paper, because when you go into the interview, you don't want to have 2 pieces of paper where you're looking at one then looking at the other. It's nice to be able to highlight the key bits of information on the abstract and then also to have your annotations all over the place. The next thing is I would recommend practice. You need to regularly print off at least 2, hopefully 4 abstracts a week in the preceding 6 weeks, okay, prior to the interview. This means that you will have critiqued 4 by 6, 24 abstracts prior to going in, and you'll feel confident doing a 27th. Practice critiquing the papers under timed conditions. For the London interview, you will be told that it's 30 minutes to prepare. Realistically, it's about 25, okay? So set the timer for 25, practice critiquing a paper in 25 minutes, and then come to the real thing, you'll be a master. So I just want to emphasize the next point, which for me was the most important point, because I'm quite a visual person. Use colors, or what I personally did was I used smiley faces and sad faces to highlight the strengths and the weaknesses on that piece of paper, that single A4 with the abstract printed on it. And what it meant is that if the examiner asked me what were some of the key weaknesses, I'd look down and I'd see the sad face, sad face, sad face, and I'd just say, oh, the weaknesses were A, B, and C, okay? And I could immediately look down. There's a visual thing, which meant I could quickly come up with the weaknesses. If you're someone who likes to work with colors, then you could just put red if there were weaknesses and green if there were strengths. But I would definitely make it really clear where you're putting your strengths and your weaknesses, so that when you go in to present, you've got that information readily available. Yeah, so on my piece of paper, I literally had loads and loads of smiley faces and sad faces, which probably looked quite weird for the interviewer, but it meant I could speak quite confidently to them, because I could quickly refer to my A4 piece of paper. I would also recommend that you use this as an opportunity to bring up your own research, okay? So if you are reminded, even in the faintest way, of something that you've done previously, bring it up in the research interview. Even if it's just, oh, you use that statistical analysis method, bring it up, say, oh, that reminds me of a study that I was a part of, or a poster that I presented, and then hopefully then it will allow the interviewers to then ask you questions regarding your own research, which will be quite nice to cover. Okay, and then finally, I just recommend that you make sure that if you're going for some of the other interviews outside of London, you've got a couple of papers that you're quite familiar with, that you know inside out, that you know the story of, the strengths and the weaknesses, and how you'd push it forward. And the reason why I do that is because for some of the other interviews they might ask you about research that you're interested in, and it's nice to be able to drop those papers, and it shows that you're actually quite a well-read person. Okay, thank you very much for watching this video. Like I said, you need to make sure that you check out the stats video as well, because that'll complete the whole thing. I hope you found it useful. If there's something that I've missed out, just leave it in the comments below, and until next time.